Hello students, in this video we are going to discuss another important type of incompatibility in pharmacy known as the therapeutic incompatibility, right? So now, unlike chemical or physical incompatibility, here the drugs may not react chemically or physically, but the therapeutic effect that is produced in the patient is not what the prescriber intended. That means the effect that is produced after taking the medication is not equal to the effect that you have thought of or the effect that you have aimed of, right? The effect that has been produced will not be equal to the intended effect. So in simple terms, you can say that the therapeutic incompatibility occurs when the pharmacological effect produced by a prescription is different from what was intended by the prescriber. So this one you can write it as a definition of the therapeutic incompatibility. Right? So the medicine may be still they are chemically stable, but it may produce an undesirable or even sometimes harmful therapeutic effect. And these therapeutic incompatibilities, they may occur because of several reasons. Okay, we will see few reasons, some 4 to 5 reasons here about the causes of the therapeutic incompatibility. The first one is the error in dosage. Here we take the example of atropine sulfate, right? So this is the most serious type of the dosage error occurs during dispensing when an overdose of the drug is prescribed. Okay, whenever the overdose of drug is prescribed, generally it comes under the category of error in dosage, right? So it is the responsibility of the pharmacist to carefully check the prescription before dispensing the medicine. If the prescribed dose is higher than the recommended dose, the pharmacist should refer the prescription back to the prescriber for correction. For example, in a prescription that the pharmacist have received, the prescription is given as atropine sulfate, which is of 0.006 grams, phenobarbital. Okay, phenobarbital is about 0.015 grams, and aspirin is about 0.300 grams. So here the dose of the atropine sulfate that has been prescribed is higher than the recommended dose. So as soon as we identify that this dose is very much high, the pharmacist should not dispense the medicine immediately. Instead, the prescription should be sent back to the prescriber for correction of the overdose, right? And the next reason, the possible reason for the therapeutic incompatibility could be the wrong drug or the dosage form. So sometimes the therapeutic incompatibility occurs when the wrong drug is dispensed. Why the wrong drug will be dispensed even though we have the correct name in the prescription? Because some of the drugs, they have very similar names which may cause the confusion. Okay, they have the similar names, like for example prednisone. Okay, prednisone and prednisolone. So till here it is prednisone only. So here lone, okay, it has to be seen correctly and then it has to be dispensed. And again digoxin and digitoxin. Like this, we have various examples where the names will be confusing. Okay, so if the pharmacist dispenses the wrong drug, it may produce the unexpected therapeutic effect. And another problem occurs when the dosage form is not clearly mentioned in the prescription. So what are the dosage forms? It could be either tablet, it could be a capsule, it could be an injection, or it could be a syrup, isn't it? There are various types of the dosage forms. Especially these type of the problem comes when the same drug have various types of the dosage forms. So if the dosage form is unclear, the pharmacist should again seek clarification from the prescriber before dispensing the medicine. And then the third one is the contraindicated drugs. Right? So here this is another cause of the therapeutic incompatibility. The contraindicated drugs are nothing but the medicines which should not be used in certain diseases or which should not be used in certain patients. So, contraindicated in the sense they should not be used in certain patients, or they should not be used under certain disease conditions. Like for example, corticosteroids are there. Okay, these corticosteroids are contraindicated in the patients with peptic ulcers. Penicillin and sulfonamide drugs are generally avoided for the patients who are allergic to it. Cardiovascular drugs should be contraindicated in the hypertensive patients. Okay, so if such drugs are prescribed, then they may cause the adverse effects for the patient, right? And then synergistic drugs. Synergistic drugs are nothing but when these two drugs are combined together, the actual effect that they have to show may be increased. Like when alcohol and sedatives are given together, already sedatives are causing the drowsiness. When it is associated with alcohol, it gives still drowsiness. In the same way, the aspirin and warfarin. Okay, aspirin makes the So here the aspirin and warfarin, they alters the anticoagulant effect of the substances. Okay, so in this way the synergism affects, and again it causes the therapeutic incompatibility. And then we have is the drug interactions. So these drug interactions, it may increase the effect or decrease the drug effect, or completely it may show the toxic effect. Like for example, calcium salts along with it of the tetracycline. Okay, these are contraindicated. Here they show the drug interactions, like the calcium salts with the tetracycline, they form the insoluble complexes, right? They form insoluble complexes, and because of this the drug becomes less effective. And then another example we have is the antacids and tetracycline. Okay, so this antacids, it reduces the absorption of this tetracycline in the stomach, decreasing its therapeutic effect. And again warfarin and aspirin also, here you can take, where the drug affects the blood clotting, and when taken together they may increase the risk of the bleeding. So these are various types of the therapeutic incompatibilities that we have. So in order to summarize this, the therapeutic incompatibility, it occurs when the pharmacological effect of a prescription differs from the intended therapeutic effect, and the major causes includes the dosage errors, wrong drug or dosage form, contraindicated drugs, or even the drug interactions. So understanding the therapeutic incompatibility is extremely important because it helps the pharmacist ensure the patient's safety as well as the effective treatment. Hope you all understood this therapeutic incompatibility better. Thank you.